Assalamu alaikum. Your Excellency and distinguished panelists and participants, and it's a great pleasure for me to be here. Thank you, Mohammed, for the invitation and the invitation from the organizers. I'd like to begin this presentation with a Sufi mystic parable highlighted by this slide here. 3 blind men were asked to walk into a room to touch the first object that they found and to come back and describe what they had discovered to the master. The first blind man did just as he was ordered and came back to say that he had discovered a snake that was round, wiggling, and was the size of both of his cupped hands. The second blind man also did as he was ordered and came back to describe a tree that was so large he could wrap both arms around it. And the third blind man also did as he was ordered and came back to describe a small rope that he could cup in one hand. Teaching of this parable is that each of us come into this room with a specific defined worldview, or a mental model, if you will, and that this mental model that we carry with ourselves is by no means complete nor perfect. And so, in fact, it's maybe very far from the truth. So the fact that self-awareness of our own imperfections or personal limitations is the first step on the pathway to humility, which is the queen of all virtues. It's critical for those of us that are working in the global arena to our success to understand the customer. So a disappointed salesman of Coca-Cola returned from his Middle East assignment in Saudi Arabia. A friend asked, "Why weren't you successful with the Saudis?" The salesman explained, "When I got posted in the Middle East, I was very confident that I would make a good sales pitch because Coca-Cola was virtually unknown there. But I had a problem. I didn't know how to speak Arabic. So I planned to convey the message through 3 posters. The first poster was a man lying in the hot desert sand, totally exhausted and fainting. The second poster was a man drinking our cola. And the third poster was a man now totally refreshed." Then these 3 posters were placed all over the place, everywhere. "That should have worked," said the friend. The salesman replied, "My problem was that I didn't know that Arabic was read from right to left." I'd like to talk about 3 principles of working in the global area. The first is transparency, the second is trust, and the third is the top priorities. His Excellency gave an outstanding presentation this morning, and I'd like to amplify the points that he's made. So we have a registered mark in my company called "There is no dust in a darkened room," which means that unless a program, specifically a public health program, examines critically the elements of program management, they really don't know what's wrong or what needs to be fixed. So when I talk about transparency, I'm going to give you a story about this very beautiful scarf that which many of you will recognize, and I'd like to tell you where I got that scarf from and its meaning to me personally. But first, let me talk with you about my experiences working in the kingdom. In December of 2008, under the leadership of His Excellency, we began a collaborative effort working through our U.S. Army with the Office of Personnel Management to determine and develop an integrated surveillance system for reportable conditions that are in the hospital, nosocomial infections and iatrogenic infections. It was an outstanding project which is still ongoing. But then over the period of time, we began to develop a more thorough relationship in the healthcare sector in the kingdom and began to look at some of the public health programs to turn on the lights in the room, if you will, to help His Excellency and the healthcare sector become more efficient and effective in their program management. So we worked with Dr. Hanan Balki, who you heard this morning, in developing a program and a project to evaluate the tuberculosis program as well as the hepatitis program, and discovered some areas of improvement. And in this case, we have Dr. Balki is the first author of a manuscript, which is a result of one of the projects that we've been working on, which looked at the risk factors for healthcare workers becoming exposed to tuberculosis in the healthcare setting. In addition, 2 of my graduate students spent their summer in working with Dr. Balke on these projects. We have an exchange of scientific expertise, if you will, and in a collaborative way. In addition, we've begun to work with the healthcare sector on looking at tuberculosis control. His Excellency mentioned tuberculosis this morning. So one of my graduate students working with Dr. Ziad Mamash, my graduate student Jessie Gleason, spent the summer working on her thesis in the Kingdom, doing an analysis of the national TB data, and that manuscript has now been submitted, and there were important findings that came about. So the ministry was able to expand their productivity, and my graduate students had an opportunity to work in a very exciting venue. Then in May of 2010, His Excellency kindly visited Emory University and signed an MOU with our dean, Dean Jim Curran on the left, establishing a relationship that was built upon the exchange of scholars, collaborative research, et cetera. It's a very important relationship with Emory University, the Rollins School of Public Health. So this past September, we welcomed the first cohort of the King Abdullah Fellowship Program. So we have six students, 6 Ministry of Health physicians who are now working on their Masters in Public Health at Emory University, and they have done really outstanding in this first semester. In fact, as I mentioned, they're at working now because today is the first day of finals. So they're not here in the audience because they're studying for their finals. So after their 2 years at Emory, they will conduct their master's research in the Kingdom this next summer, working on these important areas that were mentioned earlier: diabetes control, obesity, some surveillance issues, and some infectious diseases. And then they will go, after their completion of their thesis, which would be May of 2013, they'll go back into a new position in the Ministry of Health, working and highly trained in skills of research, working in public health. So this is the first cohort. Next year, we will welcome an additional set of students from the Ministry of Health who will come and will begin to develop this transformational component in the health sector. So we welcome you to look at this program. We're very excited about it. This is a picture of the scholars. They came yesterday and had a chance to visit with His Excellency, and they were very, very excited that he's here in Atlanta and to meet him while he was here. So I'd like to also acknowledge the extraordinary support that we've received from Dr. Samar Al-Sagat, who is working as the Director of the Department of Medical and Health Programs in the Royal Embassy of the Saudi Arabia in Washington. She was instrumental in helping negotiate this contract and arrangement with Emory University. Of course, we've worked with His Excellency also on these important events. We talked this morning about the Hajj. So I was fortunate to lead a CDC delegation to work with the Ministry of Health in June of 2009 to help them go through a pandemic preparation for the 2009 Hajj, which, as you may remember, was right before the H1N1 epidemic. So it was an outstanding opportunity as a part of a world-class group of scientists to come together under the leadership of the ministry to review the preparations for the Hajj. And of course, this was one of the outcomes, mobile-based infectious disease surveillance system. So we helped the ministry develop surveillance for infectious conditions using mobile technology. So the health workers were in the field entering data on their smartphones and communicating that health data back to a central communication center in Mecca. So we're very excited about this. You all probably know all about the Hajj. Those of you from America have done your homework, I'm sure. It's a very important convocation of extraordinary number of pilgrims yearly that His Excellency has responsibility for maintaining their health. And so we work, he mentioned this work on the science of mass gatherings, and we are very fortunate to work with the ministry staff in developing really smart, forward-looking science around surveillance and preparations for protection of the pilgrims during Hajj. These papers, as he mentioned, have been published in The Lancet and are really developing a whole new field of mass gatherings, and we're very excited about this. So where do we go from here? I think it's important to think about, in a futuristic point, what we can do to support global public health in general, And I think that one of the areas of work that we've discussed, and His Excellency mentioned this, is tobacco control. We all, in the United States, we struggle in our prevention programs to try to reduce the incidence of tobacco control. And one of those policy measures, and I'll make this case that it's people, the policies, and the politics that are really the most challenging elements of this. The information technology and the know-how is there, but taxes on cigarettes have a direct impact on reducing cigarette consumption. We know that from our experience in the United States. So we would encourage these sorts of policy reviews to occur in the kingdom, and studies that would demonstrate their effectiveness. So science will lead the research that His Excellency mentioned. As a part of the Ministry of Health will lead the policy formations. Diabetes prevention, as well as obesity, and also promoting lifestyles that are recreational exercise, in addition to injury control. Those are the areas of public health efforts that we're very concerned about. So I mentioned to you about this scarf, and I'd like to close with just a personal reflection in solidarity. This scarf, which you may recognize as a Palestinian scarf, comes from a friend who's a nurse. She's a TB nurse who works in the kingdom, and she's Palestinian. And so I have a close identification and friendship with her. She's totally focused on doing prevention and tuberculosis, and is an outstanding TB nurse. The Trail of Tears is you're here in Atlanta. The Trail of Tears is an historic event in the United States where in 1838 there was a forced migration of Native Americans from North Carolina to Oklahoma. And I was born in Oklahoma. My sixth-generation grandmother was a Native American Cherokee who was forced migrated from her home in North Carolina to Oklahoma. So I identify very carefully with this Palestinian nurse who's working to do good as she awaits the opportunity for her to return to her homeland. The fortunate thing for my family is that I now have a second home in North Carolina where my ancestors came from, and so I can do good in the community now, and I wish the best for her. Thank you.